Opioid usage has skyrocketed in Indiana during the pandemic, and the Indiana State Museum wants to get the word out. Lily St. Angelo reports on an exhibit currently on display at the museum.
More than 800 Hoosiers died in the first 6 months of 2020, according to Indiana Department of Health preliminary data. That's a 41.4% increase compared to the first 6 months of 2019. Emergency room visits due to overdoses were up 52.7%. But even before the pandemic, the opioid crisis was taking hundreds of lives every year in Indiana. Museum CEO Kathy Faree took notice and asked the community how the museum could help. Based on feedback, the museum opened an exhibit in February called Fix: Heartbreak and Hope Inside Our Opioid Crisis. Museum exhibit developer Kathleen Donnelly said the exhibit informs visitors about the drug and its effects on users. The exhibit is also intended to reduce the stigma of opioid addiction.
There's so much stigma around the disease, and we're trying to help people understand that this is a disease, treatments are available, and recovery is possible. So we're trying to help people have that empathy to reach out and help other people, particularly if they have a loved one or a neighbor or a friend who's suffering from opioid use disorder.
Walking into the exhibit, visitors learn about the science behind opioids and the history of their use. Although it can't be confirmed, Mary Todd Lincoln is thought to have suffered from an opioid use disorder.
It's surprising to many people to realize that it goes way back to the Civil War, when people were actually, particularly veterans who were returning from the war, had experience with opioids, and then it was very difficult for them to recover from that. And that kind of ballooned into a crisis similar that we have today, but it was well over 100 years ago.
Another corner of the exhibit helps kids understand pain. People are sometimes prescribed opioids for pain relief, but according to the Mayo Clinic, they are safest when used for 3 days or less to avoid addiction.
Your nervous system is fine-tuned to pain, reacting faster than your conscious thoughts. Ready? Keep your hand on the sphere. Don't move. Just 1 second. Here it comes. Just kidding. You weren't really shocked.
Throughout the exhibit, story booths allow visitors to listen to the stories of 16 people who are in recovery from an opioid addiction or have a loved one who is affected.
I don't think that I can make it through this without a little bit of help.
I did not have personal experience with this, but certainly meeting the people who came in for the interviews, we did a lot of interviews, and the stories were really amazing. And these are people who are, for the most part, like I said, are in recovery, and they've overcome enormous odds to get where they are today.
The last part of the exhibit highlights the recovery process. Interactive areas for yoga, music therapy, breathing exercises, and creative art show visitors different methods for handling stress, a key lesson in the recovery process. The 4 dimensions of recovery are making healthy choices, having purpose, having stable housing, and being in community with others. Donnelly said the extreme increase in overdoses in Indiana during the pandemic may be linked to people not having access to some of these key foundations. For Donnelly, talking to people in recovery has given her a new perspective on the opioid crisis and hope for those struggling with addiction.
It's a problem that is not insurmountable, it is treatable, and hope is there.
One way the exhibit urges the public to help is through training in administering naloxone. The museum lists upcoming trainings happening across the state on the exhibit's website at indianamuseum.org. The exhibit will run through August 1st, 2021. For Indiana Newsdesk, I'm Lily St. Angelo.
Increasing feelings of pleasure and decreasing feelings